Hi, welcome back to Rohrich Knows, helping you become a better and more informed you. We talk about neuromodulators, especially Botox, a lot. And not only its cosmetic effects, but it's also its other non-cosmetic effects, including masseter treatment. And one of the most common things I hear is that my Botox isn't lasting as long as I'd want it to. And usually lasts 3 months, maybe a little more. And there's some certain factors that I think can influence the longevity of it. And sometimes when people get it every 3-4 months, you do develop a tolerance to it. So I would tell you, sometimes you need to switch to another neuromodulator, a different type of neuromodulator like Dysport, and that can actually influence your longevity as well. But here are 7 tips that I think are key to helping prolong Botox effects. And number 1 is science, the science of taking a supplement, a zinc. Exercise, managing stress, topical peptides, health and lifestyle, and then the use of low-dose Botox, and then heat exposure. So let's go through each one of these 7. So the first one is zinc. Zinc can enhance the Botox effects due to its role as a cofactor in the neuromodular mechanism at the neuromodulator level of botulism toxin. So it can increase this significantly. And the other thing is, you really should be taking zinc at least 30 milligrams a day anyway, because it's such an incredible supplement that actually augments all the other nutrients and proteins in your body. So I think it's a very safe and powerful way to use this supplement, which I think is one of the 5 key supplements. And I refer you to one of my other recent YouTubes on the supplements I take that are science-based. And number 2 is avoiding stress, especially strenuous exercise for at least 48 hours after treatment. I tell you, the people that really metabolize Botox a lot are ones that exercise a lot, that are very lean. So I think exercise increases blood flow and can spread it away from the targeted muscles and reduce its effectiveness. So I think if you avoid heavy exercise for at least 48 hours, that will help a lot. And that'll help maintain and minimize the neuromodulator breakdown. And then, of course, a common knowledge one is managing stress and cortisol levels. Chronic stress can certainly increase your cortisol levels that may degrade Botox faster than by accelerating, because it accelerates metabolism. So I tell people, if you can do stress management, yoga, meditation, all these can prolong your neuromodulator results. The other one that I think is very, very useful is an acetyl hexapeptide 8, which really can, it's a topical peptide. This one happens to be made by Revision. It's called Reoxline Relaxer, and I give it to all my patients, or suggest they use it after Botox, because it actually prolongs the smoothing effect, and it supports smoother skin texture and reduces fine lines. So it can enhance the Botox effects as well, and also it improves skin quality. And Revision is an excellent skincare company that's truly science-based. And the role of retinoids are also very important as well, but not as much as these peptides. And then number 5 is maintaining a healthy lifestyle, nutrition and hydration, especially keeping hydrated in a diet rich in antioxidants and omega-3s. These are all support skin health, but also can complement neuromodulators. This data is a little bit softer, obviously increasing your consumption of water as well, and a balanced diet. All these will help reduce the oxidative stress on the skin and will prolong the effects of Botox. And then number 6 is something that I think is really very valuable, especially if you get it very regularly, that you could consider low-dose neuromodulator injections at regular intervals. I think that many of my patients come in 2-3 times a year. They really should come in every 3-4 months, because then you can actually maintain a lower level of microtox or Botox, and that can prevent some of the muscle movement without waiting for the full effect to wear off. So I think if you just keep doing it on a much more regular basis rather than a couple of times a year, do it 3-4 times a year, that actually will maintain your neuromodulator longer. And then finally, it's heat exposure. I think heat increases circulation. That can actually spread the neuromodulator away from the target muscle. So I would avoid hot environments like saunas and steam rooms and hot yoga sessions for, again, 48 hours after treatment. So it's either, the exercise and the hot treatment with things like saunas, I think are very, very important. So these are 7 key things that actually everyone should know about. They're common sense things that really, I think, will help you not only have a better lifestyle, but also prolong the longevity of neuromodulators. So please leave me your comments and your questions, as you always do, and I'll be happy to answer them in my regular sessions here on my podcast or on my YouTube channel. And thank you again for tuning into Rohrich Knows podcast. Have a great one.